right. Does he need to say anything about?
No.
Okay, great. All right, let's see here. So the first item is advertisement and hiring for a wellness coordinator position. We have a position that's funded through DHS, I think for 17 years or something along those lines. And they work with the Northwest 13 counties for alcohol, tobacco, and other drug prevention. So they support community coalitions and work around community efforts. And this position is solely funded by DHS, the Behavioral Health Division. The current individual was offered a position directly at DHS and an offer that they couldn't pass up. So, unfortunately, this is an individual who is a fantastic employee that we're going to super miss. So, looking to rehire that position and any subsequent vacancies that it might.
What is that acronym? ATOD.
Alcohol, tobacco, and other drug.
I'll move.
Is there a second?
Second.
Any further discussion? If not, all those in favor say aye.
Aye.
Those opposed, motion carries.
Thank you. The next item is related to our foundational public health responsibilities. So, a little bit of background. We received funds from the last legislative session, not our most recent one, but last year, for foundational public health responsibilities. And essentially, what that means is there's national standards that are expected across all health departments in the nation. And in Minnesota, some health departments, specifically smaller health departments, have been identified as not being able to meet all of those responsibilities and capabilities. And so the legislature recognized that as part of our COVID response and really lingering long before that. And so there was funding that I mentioned last fall when we were doing our budgets, that there would be a funding work group, which Joan graciously participated on, to identify a funding structure. And so that funding structure was identified, and we had to identify the areas within these responsibilities or capabilities that we need to work on for a community health board. So these are the bulleted items here. You can see there's 6 of them. There's multiple different responsibilities and capabilities. These are the ones that we have been working on or need to work on. And so the funding formula is in place. We've done our assessment to identify these areas. We are utilizing roles and responsibilities for 2 individuals within our department to reassign their roles and responsibilities to this work because of their education and work history. And then there's 1 individual that's being hired at Norman Minoma Public Health as part of our community health board to work on meeting these needs. And so the request then is to fill those positions that have been reassigned to other duties. So one being a .8 wellness coordinator for the statewide health improvement partnership. That the person is currently .8 and rehiring at .8. The second position is a .8 registered nurse or public health nurse. So that, and then of course any subsequent vacancies that might happen because of that. So the funding, it comes from the legislative funding. It's in the base funding. You can see the details here, and we've talked about this a few different times as well. But that's all of it in a nutshell, the historical piece. And certainly happy to answer any questions.
Any questions?
So moved.
Thanks, Joan. Is there a second?
Second.
Second by Mark. All those in favor say aye.
Aye.
Those opposed, motion carries.
Thank you.
Foot care.
Foot care. Oh my goodness. Okay. So foot care is a public health service that has been a community identified need for decades. It is not a required service that we provide, but when we do a community health needs assessment, it comes up every time as a priority. We have podiatrists and other medical providers that refer folks to us because their schedules don't allow. Their schedules are full, and so sometimes folks come to us for regular foot care. We also have seen over the years the opportunity to reduce folks isolation and sort of that sense of connection. And we certainly have identified through our nursing assessment lots of health issues relative to foot care, and made those appropriate referrals and got people care. So we provide foot care in East Grand Forks, Crookston, and McIntosh. Always, if there is a provider out in the community, we refer folks to them. We are busting at the seams. We have a 2 to 3 month wait list. So we're in the process of trying to figure out if we can provide additional options. Obviously, our population in Polk County is aging, and foot care as it's related to our overall health is really important to our residents. So this is a locally assessed need that we have been able to provide over the years and is very valued by our folks in the community. So we have a fee or suggested donation of $20. That has not been changed. It's been at least a decade. It might even be longer. And so, because of the July 1 nurse salary and fringe change with our contracts, even before that, the $20 wasn't covering our nurse time. So the reality is that we need to move to cover the cost of that that nurse time. So I'm recommending a fee or suggested donation of $30 starting on September 1st, so we can give out some notifications and make folks aware. We do always have the caveat that if there is inability to pay or some other need, like we ask them to pay what they can. And typically people have not had an issue to pay the $20. So
Can I throw in something?
absolutely.
Sarah, have you looked into as a nursing service, is a CPT code to that effect, where you guys can be reimbursed for that?
So we currently only have uh, a contract for people on medical assistance or on the state programs. And to be honest with you, we would have to hire, like, we serve almost 1,000 people a year for foot care. So we did the math, and we would actually have to have another billing person to like do all of the pieces related to billing. So that's why we haven't gone down that road.
It is so unfortunate because the
Absolutely.
need is so ecstatic in what happens. This is for y'all knowledge. If I see somebody and I do a CPT code and getting reimbursed for that is almost zero. So you're not discouraged. I'm not discouraged. I see them all. They come in, but unless there's an ingrown toenail or something associated with it, you don't get hardly reimbursed. And so therefore, for providers to find time in their schedule, I understand your response there. That is the issue. It's a reimbursement issue. They just don't tell you that publicly. It's a reimbursement issue. And I see them all. Doesn't matter reimbursed or not. Well, the word's out. I'm sure I'll get crucified, but that's life. But I'll see them. So if you have problems and there's somebody that really needs them, you send them. They won't get refused.
Right.
And but the point is, if there's some way we can recapture that with a CPT code somehow, and if we need to somehow hire that, maybe that's something we need to do. If there's that big of a need and we can't get it through the local services with the medical providers through our region, then maybe that's something else we need to look at.
And some of the foot care is preventative in nature too, right?
Exactly.
And so it goes everything from like preventative care to diagnosis to kind of
Exactly.
everything in between.
But if you don't clip their nails, they're going to have
Absolutely.
bad. But I can't. Medicare will not pay me to clip somebody's nails.
Right. Mhm.
It has to be an ingrown.
Yep.
If it's not ingrown, and that can be found, but if it's not ingrown, I can't clip them because there's not a charge for that.
I understand the increase in the demand, but the percentage increase is significant,
Oh,
33%.
The
And
$30 actually doesn't even cover all of the cost.
I
The
understand that.
$30 covers the cost of the nurse time simply when they're doing the foot care. It doesn't cover the supplies or the charting time. So if you would like to propose another amount, I'm open to that. This is just what we propose relative to the nurse cost for the actual service. We're still eating some of the cost, and there isn't another funding source for that. So if you want to recommend something else, I'm totally open to that.
Question, and I understand the increase for the fee. Is this, when you mentioned 1,000 clients per year,
I think it's like 857 or something odd like that.
and that's all in the offices, or do you do outreach into nursing homes, that type of thing?
So in East Grand Forks, our location is at the senior center. In Kirkston, it's also at the senior center at the Golden Link, and in McIntosh, it's at our office.
Okay.
We have a lot of people that come from McIntosh.
My dad, when he was at Good Sam, the reimbursement, they quit trimming nails there. And unfortunately for him, he needed a grinder.
Everyone has different needs.
Yeah, but it's a real problem. And
Absolutely.
it-
That's why we continue to do it. There, if you look across the state, we are constantly asked, why do we still do it? And I'm like, don't talk to me about this because this is a community need and
No, I
this
think
is what
that's
we're
very,
doing.
very good.
But
should be
there
doing.
hold
across
up on
the
that one.
state, there is many public health agencies that are no longer offering that service. And I'm like, that it is a community need. This is at the end of the day what we need to do.
and unfortunately, even in my dad's case, it was a mobility issue. If you're
Absolutely.
even thinking of ourselves,
I understand.
Yeah.
when you get an ingrown toenail, you don't
They
want to
lead
walk.
to ingrown toenails. Period.
Yeah.
And so
Yeah. It's a huge
yes, the
need.
fee is 33%, but I think you're only going to get more and more requests.
Yeah, we have a 2-month waiting list right now for
Yeah.
all of our locations. Like it is, we're trying to figure out how we can fit some more folks in because we have a need, which is great, right? That speaks to the service that our nurses are providing. I mean, word travels quickly, and so it's great, and it's a huge need, and we do understand. I think it's one of those examples where, like, if each year you increase by 3%, it doesn't feel as large, but since we haven't increased it for so long, it feels like such a jump, and
Okay.
that's just the nature of the beast.
And it still comes down to it's a recommended don't fee,
Yes,
suggested donation.
absolutely,
Really.
yes. Mhm.
And you would take 20 or 25 or
Exactly.
24.50 or
Yes. Yep.
so.
Yeah,
I-
and
And if
that's
it's 24.50, I'm finding 50 cents out of my own pocket so we can give back a thought, or we can have that be a
I
whole
would
number.
also, if you need supplies, you can send your gals to come and see me, and I'll show them better tools that we can purchase. The county could purchase to make that job a lot easier, maybe a little bit faster, rather than an old-fashioned
Mhm.
clippers.
Yeah.
More than happy to show you what real tools do and how much faster it goes.
Get one of those grinders at,
The
I can't-
grinders are not okay in Minnesota.
Right.
So you got to go to North Dakota if you want the grinder.
Oh, a farrier.
That
Yeah.
is correct.
No grinders here.
Oh, but yeah,
Yes.
I've been at the Macintosh office, when during foot care days, and I mean that place is packed on
Hoppin'.
there. But I mean, you also touched on the the social aspect of it.
Yes,
Mhm.
that's huge,
Mm-hmm.
but these people can't walk sometimes.
Right.
And the
Mhm.
minute you help them and they stand up and they walk out and they say, and their smile is this big and they walk out, and I know I'm not getting paid for that person. It's the way it is.
I've been to Macintosh on clipping day too, and it's full.
Mm-hmm. Mm-hmm. Yeah, but yeah, and like too, it's it's
You did
kind
a
of
good
like the
job.
same with the
No, I
teeth.
was just
It
happened to
can
walk
lead
through.
to so many different things that.
Yeah, it's the same conversation, right? Like your teeth and your feet are a huge indicator of your overall health. So,
Mhm.
hence why we're working on both of those.
Yep. Mhm.
So I'm more than well. They can call me or come in.
Yeah,
and
I'll let them know.
I'll show them some
Yeah.
real handy tools that are legal to use.
Yes. 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 No, that would be great.
I'll move the suggested fee schedule to $30 per visit.
Second.
Any further discussion?
It's a sad deal.
All those in favor say aye.
I
Those opposed, motion carries.
I know we could have so much discussion on feet.
I have a love-hate relationship with feet also, so I'd love to talk about it a lot.
Yeah. They're
Okay.
connected to shoes.
Right, exactly. All right. So the last item is an out-of-state travel request for Sarah Shimmick. She is one of our wellness coordinators. We typically, through our DHS funding, the funding that I was previously mentioning for the individual exiting that role, we get funding for our health department to have someone participate in the Montana Summer Institute, and that's a best practices workshop in terms of working with communities and professionals and so forth. And so the state has recommended that we have another employee participate in that. So all of the costs are paid for by DHS through our grant. And so I would recommend or request for Sarah Shimmick to participate. And we've participated this in the past. It's a really great conference. So looking for out of state travel approval.
Your motion to approve?
I'll make it.
I will second that. Any further questions? If not, all those in favor say aye. Motion carried.
Thank you. I'm gonna leave that here. I don't want to be in
You're at the
charge
Polk
of-
County Fair too, I'm guessing?
Yes, we will be at the Polk County Fair.
Always a nice job.
Fair Board and Public Health. Yes, thank you.
Mhm. And talent.
Yes, and the talent show and the 5K.
Oh, good.
If you want to join the 5K, Saturday morning
I want to be
or
here.
the talent show Thursday night.
Yep.
Chuck Whiting is up next.
6:30 Thursday.
Thanks.
I am filling in for Rich. So keep that in mind as I try to explain some of these contracts, if I can find them. Let's see. The first item is approval of the agreement, agreement 1056198 for bridge bonds in Columbia Township. This is a bridge over the BNSF rail. The amount is $1,207,952. This agreement is needed along with the resolution that accompanies it in order to receive the bond funds. We ask for approval on those.
Any questions?
Two separate resolutions, correct?
Yeah, I don't know that that's necessary, but that's the way Rich does them. One is gives the administrator and the chair the go-ahead to sign, which so does the resolution, but that's how we have it on the agenda. The resolution number is 2024-47. Approving the agreement.
Is there a motion to approve?
Grant covers the total project, apparently.
I believe so, yes.
And this is where is this at again?
Columbia
Yeah.
Township.
Move to approve.
Okay, is there a second?
Second.
Thanks, Warren. Any other comments?
Rich presented this,
while back,
3
right?
meetings ago, or 2,
This
for
is
sure.
the one that I think where it had to come back because
Yes,
the
that's the
bids
one
were
he
too
talked
high.
about. It had to come
Mhm.
back because something was, right.
Okay, all those in favor say aye.
I,
And those opposed, motion is carried.
Okay, so the next two items or next two items under Rich have to do with the roundabout project. I should mention, by the way, that there'll be a public meeting on that next Tuesday, 3:30 at the One and Only, per your request. The first resolution, which really makes sense having ahead of the second one, is the agreement with the DOT for the detour around the construction area at 21 and 75. Roads that will be used for the detour are Alcazar Roads 19, 20, and 23. And for that, the Department of Transportation will reimburse us $7,581.91. So look for approval for, what is it, the resolution, or is you got just the agreement? It's a resolution approving the agreement.
And which I'm sure you can answer, but what's the reimbursement for?
Usage of county roads, and I think there's a term in here for it. Where is it?
yeah, that's,
Computed. It's computed.
Road life.
Yeah, I guess road life. Not to exceed $30,000, which it does not.
Which
It should have.
it should have, I think $7,500, whoever came up with that calculation. I think it should be closer to the 20 to 25,000.
It should be $29,999.99.
The 220 project is creating all kinds of caveats, and yes, $7,500 is a calculation. I get that and I understand that, but reality, there's truck traffic and so forth and so on going different directions than normally it does go. And unfortunately, for this roundabout construction, it's going to be significant wear and tear on 23, 20, and
64.
and 64 currently, but also
Oh,
19.
roundabout,
Yeah.
okay, yeah.
And yeah, I not objecting to the motion, but I don't think the dollar amount is high enough. And if it's calculated by the state, I'd like to see those numbers. If it's calculated by Mr. Sanders, yeah,
We may be able to take that into account. Item B here allows us to keep track, record, and verify any claims for additional costs if we can figure those out.
We should.
Rich would know that.
then if that's the case, then I recommend that we get traffic counters out on all three of these roads to count traffic, because if it's a significant increase, then this should be significantly increased. If it's within 15% of the normal traffic counts in those areas, then I'm okay with this calculation.
Are
Okay,
you
so
okay if
here-
I defer to Rich on how to calculate
Yep.
that?
Well, okay, so I got, so he says that it's,
He's watching.
yes, he's watching. So he said it's based on the ADT, which is the actual average daily traffic. And he said that's about 750 cars. So, and so they're at 685. And he says most of the traffic is ours. He's writing something
county.
else now.
County
Yeah.
residents, I assume.
I'll move to approve this dollar amount or acceptance of this with the installation of traffic counters on these roads.
Said it's only the 75 traffic that's being detoured.
No, it'll be a lot of traffic coming from the west. If that intersection is closed down, I would care to say there's more traffic on 21 than there is on 75.
Is there a second to the motion?
Second.
We have a second. Warren, you had a comment or,
No, not really.
okay. Any further discussion? If not, all those in favor say aye.
Aye.
It's approved.
The further discussion would not be on the roundabout project, but on County Road 64. That's basically being ruined. It's gonna need major work to bring it back.
I suspect we'll be keeping an eye on these, but I'll
That motion did
follow up with Rich.
pass. Next item.
Okay, so the next item is the actual agreement for the construction of the roundabout. Based on the engineer's estimate, the cost participation by the state is $1,912,134. In order to receive payment from MnDOT, Polk County needs to approve the agreement. Construction is to start next Monday. So the request is to approve. Again, he's got two actions here: to approve the agreement to allow the administrator and board chair to sign, and to approve the agreement itself as included in your packet.
I'm wondering if that 1.9 is not a under amount. Well,
It's the only number I can.
the only number I've seen, but it just amazes me that it isn't about 3-4 times that.
The question I have, and I'm sure we'll get the answer on Joan's phone, cost overruns, whose responsibility? Is it Polk County or change orders or cost overruns? Is it the state's obligation to the 1.9, or how is that handled?
I don't know if he's watching or not. I do not know.
He's not writing
I will
anything.
not venture to guess. My
Think it
guess
would
is
be
that it's going to
appropriate to
be
be a part of any
DOT because of the
No,
agreement
no,
with
he's
them.
writing.
But
He's writing.
He's writing. Oh, based on which road?
Either or. If there's a cost overrun,
this is for the roundabout. How about if we follow up with that at the next meeting? We won't have cost overruns by then, but
having technical difficulties again.
well, I know he's on vacation, and I know what he's doing on his vacation.
He's listening to us.
He might be preoccupied.
No, he's writing now, so.
Okay,
5 o'clock somewhere.
it's not there. It's the same time as here, but
So if it's the roundabout, the state pays.
I would be there.
The state pays any and all cost overruns.
So.
And we have that in text writing. Please save it.
well, it should be in here.
The other thing that I'm concerned about is the dollar amounts allocated to or the process to allocate dollars for repairs of township roads. There's been some issues with the 220 project and so forth and so on, and I want to make sure on this project, because unfortunately cars, trucks are going
Everywhere.
everywhere. It's like an ant farm out there. And I don't think it's the responsibility of the townships to have to be out grading every 2 to 3 days these township roads when they're doing them once every 3 weeks, if that. And there will be excess travel, not only by the local farmers, but other people trying to find a shorter, quicker way. And I think we're seeing that on County Road 64, that poor road, and I've driven it a couple times. I just drove it Saturday morning. It's getting hammered with the amount of vehicle traffic. And secondly, past our farm, which we're 4.5 miles away from 21, we're seeing increased traffic. There for a while, it was just local people, going east past our farm. Now we're seeing delivery trucks and everybody. And a few times I've gone County Road 64 way, we're seeing delivery trucks, FedEx trucks, you name it, utilizing County Road 64 as a shortcut, which it's not a shortcut when you look at the squareness of the detour routes, but whatever goes on in people's minds, they're not following the detour, and it's creating a problem. And the speed issue is the other issue.
Mhm.
So I want to make sure that the townships in this area of the roundabout have access to, if they find themselves having to grade their township roads more than normal, that they have a process available to them to submit those additional costs over normalcy to get recompensated, because it does put a burden on the local townships.
So Rich's comment was that we work with the townships to repay to get back to original status. So now I'm just asking him if that means that we use, our own funds.
So I just want to make that part of the discussion here, that we compensate. So
I'm sure this isn't the first time that we've
Yeah.
run into this kind of thing.
that's all I have to say.
Okay.
I know Rich is typing something again, so. Okay, so when I asked him about if we use, that means we use some of our funds, he says yes, or gravel or in blade time, so.
You're okay with that?
As long as there's a process in place, yes.
All right, all those in favor signify by saying aye.
No,
Opposed, motion carries.
No, that's.
I don't think we had a
We didn't
motion.
have.
no, we didn't have
on that.
motion yet. No, you're right.
Just the vote.
Did you want to
I'll make a motion.
you'll move that? Is there a second?
Second.
Any further questions? If not, all those in favor say aye.
Aye.
Those opposed, motion carried.
Okay, I don't have to be
Ahead of
engineer.
ourselves there.
Try not to be engineer anymore.
Jeez, ain't that fun?
Between drainage and roads, I'm gonna have to get in my truck and go out there and drive around it today. Today might be a good day for it. We have talked about this a little bit. We are expanding the landfill, of course, and wanted to make you aware of what we're calling here the bonding calendar, which would be the process for selling revenue bonds to pay for this. John and I are working with a consultant right now just to do a basic fiscal analysis. You should have that by early August. But there's a couple of things to note here because we're trying to follow the board meeting schedule. You can see some of these things that are just kind of normal our staff items to work on from a board standpoint. On the 23rd, we'll have a resolution to authorize the sale of the bonds. Due to our meeting schedule, we're going to suggest that we create a pricing committee, which I was thinking could be the finance committee. We could do this in a Teams meeting. The establishment of a pricing committee would allow essentially this work group, given, assuming the board gives it the authorization to do this, to award the bonds on the 27th of August, which is not a county board meeting, which moves everything up a week, allowing us to get the bond funds in hand and have the county board ratify that award on September 3rd, which is your regular meeting. Generally speaking, there are very few issues as to who to award the bond sale to, since it's a competitive bid. It's the low bid. We can discuss that more on the 23rd if you want to think about it or comment on it now, certainly.
Don't we have a county meeting on the 16th too?
Yes.
Yes,
Yeah, okay.
of July.
July, yeah.
Right,
16th and the 23rd.
Correct.
right.
Okay, good.
But this will be ready on the 23rd.
I see. Okay.
And that would be your authorization to go out for the sale of bonds.
Mhm.
Baker Tilly then would do the work needed to receive those bids. And then we would get them, they would digest them. We would then meet with what I'm going to suggest. We call it the pricing committee here, but it'd be our finance committee. Myself, probably John. We just review the bid proposals, and assuming that it's relatively easy to determine who, that would give us 1 week of a leg up in order to get the funds in hand, which would be September 12th by their estimate. But we'd also have the board, we'd present it to the board again on the 3rd for formal ratification by the board. Couple other things I'll note is they're talking to us, Baker Tilly staff is talking to us about entering into a state credit enhancement program. This has to do with the fact that it's a solid waste project, and because of that, they believe that the state's credit rating can be used, which is AAA, gives us maybe a little bit of savings on the interest, but may also place the state in a position behind the county in case for some catastrophic reason we're not able to pay the bonds. We will be able to pay the bonds. The payment of the bonds comes from the revenues generated through the landfill. That's what the fiscal analysis is being put together for. The county's tax base is used to support that in case for some reason, again, it has to be pretty extreme, that the revenues aren't there. And even if the county can't pay for it, that the state would then step in. Although this is the most unlikely thing to happen, but it does help with the credit rating. There is a likely one of the bond houses would call us, and we would do a credit rating over the phone. I think Gary and Joan have sat in on those. Usually Ron and I will take those. I'd probably have John in on that and somebody from Baker Tilly, and that would having the fiscal analysis then would also be part of the review that helps us with a good credit rating. We've always gotten the rating that is warranted for us. But it's just like going to the bank. They want to check your ability, and wherewithal to pay your debts back.
Understandable.
Yeah. So if this schedule works, and you don't have to approve it today. I mean, there's no approval or request to approve the schedule. It's just the way presenting it to you, so you know, and that we can be ready on the 23rd for these questions. We should have funds in hand by second week of September, which we'll probably have some bills by then to pay, since we've already awarded the construction.
Has there been any discussion on the cost of the bond, interest cost?
No, they'll probably run something for us, and I'm guessing we would have that on the 23rd, based on whatever the going interest rates are of similar type issues that they've worked with. I'm trying to think if I've ever had bids come in higher than the estimated cost. They're almost always a little higher than what the low bid is. I don't know how they figure that out, but it's just by looking at the market, and they can tell probably what we're going to get within reason. So you keep in mind, you just increased the tip fees to 85 a ton. I think it was at last meeting. But this may help us project down the road too where those should go, as we add this into the cash flow of the operation out there. So I don't know if you have any questions. There's nothing really to approve, but I wanted to share this with you so you kind of have an idea what's coming.
No, we have to have a plan.
Yep. Oh, and I should say, going back to the resolution we did on the for preliminary expenditures, we set a limit of $4 million. That's the number that we're using right now. And we'll see what the actual costs are as we go through the project. I think the bids were in the 2 to 3 million range, if I remember, so should be good there.
Any objection?
That looks
No,
good.
if not, let's hope to make that happen.
Just checking the schedule too, just going back to Mr. former Commissioner Dietrich's interest in a rendezvous of the group on the 25th. Joan and Gary, you're Joan, you're Gary. We have negotiations that day, so your time is going to be a little.
I won't be here.
This would probably be late afternoon to evening.
Yeah. Just if he's got a time, we can nail it down so we can post it.
Yeah.
Then the media can show up and watch you have dinner and talk.
Watch Don pay.
Yeah, that'll be
We'll decide some big issues, I'm sure.
I'm sure you will, but if he pays, that'll be newsworthy.
I know it.
That'll be earth shattering.
You know, once over the $1 tip fee that he's famous for.
That's like if that happens, it'll be like a secondary total eclipse.
Oh, gosh.
Okay.
Anything else?
For the next agenda, can you put the Wagner issue on the agenda?
I can. He's going to come in.
He will come in. Couldn't be here today because his mother is having some procedure at Mayo.
Okay.
She has cancer and it's not that great a situation. And the other question had the roundabout hearing, is that next Tuesday?
Tuesday,
The
at the
8th?
one on the
Ninth.
9th
Mhm.
Okay,
at 3:30 in the afternoon
3:30?
at the one and only.
Okay.
I can't be there. Sorry. I
will-
wanted to be.
I will try to be there.
basically at my request, but to talk about, obviously, we can't necessarily change the
The scope,
process,
yeah.
but to hear the concerns during the delay and construction of American Crystal Sugar, Trans Systems, and everybody else.
Prepare for the worst.
What, that's on Wednesday?
Oh, Tuesday.
Tuesday,
Afternoon, the
July
9th
9th.
at 3:30.
Oh, that I can make.
So if we have a quorum, again, let me know if you're coming. If we have 3 of you or more, I will post it.
I'll be there.
I'm gonna
It
try to be.
affects your area, and I think, Gary, you're Euclid now, aren't you?
No, but I've got it down. Or
And I'm not saying no, Paul.
No,
what,
I'll
what
let
township?
you know.
What township is it?
Euclid, Angus,
Okay, no,
Tabor.
I'm Brent.
I'll just post it.
Yeah, that's whatever.
Issue.
But if I can make it, I'll be there. I mean, it's a big issue.
Because we did talk about it at the TZD meeting also, so there was invites sent out to everybody that was on that.
People are concerned. I mean,
3:30.
just to
3:30.
address
3:30.
One and only in
Euclid.
Euclid.
That was the only facility,
Mhm.
and they
Oh,
No,
were.
that works. Everyone knows where that is.
We originally set it up for Monday, but they're not open on Monday, so we had to scramble and set it up for Tuesday. And they preferred it after lunch. So
Okay,
I think they snookered us before happy hour.
That might come in
That's one
handy.
I would just as well.
We want the meeting to end positively. So should get Dietrich at that. Anything else from me? I can just say we've sent the budget input sheets to the department heads. Darcy has been working on condensing some of the line accounts to make it a little more straightforward, maybe than it's been in the past. So we'll see how that goes. And I sent the department heads the proposed schedule for the initial budget presentations to myself, Ron, and now the finance committee on August 1st and 2nd. And I'll go over that with them at the department head meeting in case we have to move it around, but it's basically the whole 2 days.
We do have a meeting with Josh also on the 11th, correct? Is that
Yes,
still on?
that's, yep, that will be the
For
LALS groups
Joan and I and
negotiated
negotiating. Got it on the schedule.
next Thursday.
Thursday, correct. Right here.
Yep.
Not a problem.
Things start cranking up here now with second half of the year. Budget and negotiations, it's
Mhm. It's a lot.
We'll get her done.
busy.
Is that it?
That's it.
We adjourn.
Thank you.
10:30, that's not too bad.
August 4th work okay for you?
No, I was gonna mention that to you.
Okay.